Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Thyroglossal cyst. So what is the nature of this thyroglossal cyst? It is a congenital. Date of presentation is typically from 15 to 30 years of age. So anatomically, the relation to the thyroid and the tongue will be the thyroglossal. So there is a thyroglossal tract, and the bone in relation to the thyroglossal tract will be the hyoid bone. So bone in relation to the thyroglossal tract. So what are the common locations? Common location will be the subhyoid. The subhyoid will be the MC, that is the most common. Then also there comes the suprahyoid, and this is near the thyroid cartilage. So near the foramen cecum and also in the floor of the mouth. Now to recap, the relation to the thyroid and the tongue is the thyroglossal tract. The bone in relation to the thyroglossal tract will be the hyoid bone. The common locations will be the subhyoid, that is near the thyroid cartilage, and this is near the foramen cecum as well as the floor of the mouth. Now looking at the CF, that is the clinical features, it is a midline swelling. It is on the anterior part of the neck, and the movements that it moves with swallowing. So it moves with the swallowing or the deglutition, and it moves up with the protrusion of the tongue. So moves up with protrusion of the tongue. So complication wise, this has an abscess formation after infection. So there is abscess. This abscess formation after infection and can convert the cyst into the thyroglossal fistula. So there is a thyroglossal fistula which is seen. And there's a long-standing cyst. There's a long-standing cyst as an increased risk of the PCT. That's a papillary carcinoma of the thyroid. So treatment-wise, you have something known as a cyst trunk operation. So cyst trunk operation is the treatment of choice. Here to remove the cyst and the central part of the hyoid bone. So you remove the cyst as well as the central part of the hyoid bone. To learn and grow daily like this, please do subscribe.